Hello, I'm Philip Bluestein with Healthcare Practice Advisors, and today I'd like to talk to you about the healthcare practice as a business. Now, I'm not talking about corporate medicine. That's a whole different discussion. What I am talking about is how a healthcare practice, whether it's a medical office, a dental office, chiropractic, therapist, whatever, how it actually has to be run or actually is a business and needs to be run as a business. Several years ago, I was helping out one of my mentors, and we were at the ABA Tech Show, and we were talking to, at the time, other attorneys, and so I was having this conversation with an attorney, and he was, I'm going to guess he was probably in his mid to late 40s, so he'd been practicing for a number of years, and he had his own practice. I was having this discussion with him about various aspects of it, and talking about, the business aspects, what's important, how you, and those kind of things. And he turned to me and he said, I went to law school so I wouldn't have to own a business. And I just paused and I just thought, didn't know exactly what to say at first, but I looked at him and I said, but you do own a business, it's your law practice. And he looked at me and he turned on his heel and he walked away. We see that certainly in the legal profession, but I think oftentimes healthcare professionals forget that they're actually running a business as well. So there are a whole lot of things that go into it. And that's what we're going to talk about here today. So when you have a healthcare practice, like I've said over and over again now, it really is a business. And maybe you're saying, well, how is it a business? It's not like a restaurant or something like that. Well, here's the thing. Let me talk to you about a couple of different things about it. So when we have a business, there's a whole bunch of different aspects to any business. So every business is going to have some type of marketing. And, whatever it is, a website, whether it's advertisements, whether it's in the healthcare business, maybe it's just getting leads or getting patients from the insurance company or whatever, but there's some type of marketing. And then we're going to have a sales process. I know a lot of people think sales is a dirty word, but it really isn't. It's just that process of when we have a customer come in and they're ready to purchase, ready to move forward with a service or buy a product or whatever. Somebody's got to talk to them. Somebody walks them through that process. So there's always some type of sales process. We'll talk about that a little bit more. There's going to be some kind of product or service. Okay. And then there are going to be customers, of course, who are going to purchase that. Or patients. So they're the ones who are going to purchase the product or service. And then we have people who are working in your office. People or staff, or staff, as we often refer to them. And then we have an office of some type, office location, or maybe if you're doing an internet-based business or even telemedicine or whatever, you might be working out of your basement or something like that if you're doing things. But whatever, you have some type of office or location. And then we have our numbers. And that's really going to be our profit and loss, our budget, things for our taxes, all that kind of stuff we need to know. And that it also includes our SKUs, those kinds of things. And then arguably, there's the most important part, which is really you, the owner. And that's the most important part because none of this stuff will work without you. And I don't mean that in the sense of you necessarily providing all the services, but you're the one at the center of this. And this is often the most neglected side of it and part of it. We'll talk about that in a little bit as well. But regardless, so okay, you say, okay, well, how does my healthcare practice fit into it? I'm a physician, I'm a therapist, I'm a chiropractor, whatever. Well, you're going to have some kind of marketing. When even if you're just getting patients from through the insurance company, theoretically or technically, that's going to be marketing. But most likely, you've got a website, you've got a way to reach out to the community. Maybe you're giving talks, maybe you're doing a variety of things to do that. So there's marketing. The patient or potential patient calls the office. You're going to, quote, sell them. Yes, that if they're on the list already, if they're referred by their insurance company, that part of it, maybe not a really hard sale. But if we're in the situation where we are doing more elective type things, or if you're a practice that doesn't take insurance, there's going to be a sale process just to kind of get them into the office so they can come and see what a great doc you are or a great provider you are. And they'll have some kind of appointment. And then you're going to have a product or service, which is initially, it might be that initial consult, might be a procedure, might be ongoing therapy, whatever it is. There's some kind of product or service. In this case, it's service, although some healthcare professionals in their offices will sell various products, maybe skincare related or cosmetic grade products. They may have braces. They may have a variety of things, supplements, health plans, all that, or dietary and ongoing health type plans and things like that. Or even a lot of dentists now, more and more we're seeing where they're actually even having their own internal, as an alternative to insurance, their own internal health-related, insurance office kind of insurance plan where you pay, it's a subscription plan, and you pay a certain amount rather than getting billed. Maybe you can submit it to your insurance company, maybe you can't. A lot of people are opting for that. You have staff in your office, obviously. Even if it's just you, that's your staff. But also you're going to have a receptionist. It might be in the office, it might be a virtual receptionist, whatever it is. You might have nurses and PAs and medical assistants or chiropractic assistants or hygienists or whatever. So you've got a staff, location, office. Doesn't have to be a brick and mortar, but most healthcare practices right now are having brick and mortar type locations. So there's a physical place that our patients will go. And but again, could be with more telemedicine or maybe some other ways that you're doing that. And then of course we all have our numbers. Hopefully we have a budget. I find a lot of people don't have a budget that they've really written out, at least a forward-looking one. Hopefully we have a business plan. I find most people don't actually have what I would call a real business plan. We'll talk more about that in further sessions or further talks that we give. And part of our training, part of the education that we give is really kind of building that business plan. But regardless, so we have numbers just like any other business. And we have owners like any other business. Now, it's not like General Motors has shareholders and those are all owners, and maybe because of the size of it, obviously, unless you're a really, really large shareholder, maybe not as relevant. But with a small business, there's only going to be, in most cases, a few owners, maybe only one owner. So that's an important part. And if you're not functioning right, if that part isn't functioning right, then it can cause problems for all the rest of us. So what do I mean? Well, are you taking care of yourself? From the standpoint of health, are you spending time with your family? Certainly that's what you want to do. But are you enjoying life? Are you finding things? This is taking for you is why you went into the healthcare profession to begin with. There was something that you wanted: financial goals, professional goals, personal goals. You wanted to have a good life. Most of us, that's fair enough to say, I think, for most of us. So are you taking care of those things? Are you getting exercise? Are you taking care of your health? Are you spending time with your spouse? Or if you're not married, do you have time to even meet people or whatever, and hopefully have a family someday? If you're spending all your time doing this stuff and you're ignoring this, going to be a problem. And overall, I'm not sure exactly what the divorce rate is for, say, physicians and dentists. We know that the divorce rate in our country is probably, by some estimates, 50% or higher. So I would imagine, although I don't have the numbers right now, but I would imagine it's probably higher for doctors. And so one of the reasons is that people forget about this very important aspect of it. So that is something that we definitely want to spend time on. We're not going to go into all of that today, but this is kind of what is important. This is why we're a business, why a healthcare practice, or in my case, a law firm, or any other business. I'm a practicing attorney, as many of you know. I have a law firm which is separate from this. separate from healthcare practice advisors, but a law firm is a business, an accounting practice is a business, a restaurant's a business too. So the healthcare practice is a unique type of business. There's certain things that don't apply for other types of business, but it's still a business, and to be successful, to grow it the way you want to grow it, you need to take into account all these different aspects of your business. That's what is going to help you achieve your goals and go forward the way you want to go forward. A lot of people choose to give up the idea of having their own practice. Well, that's fine. If that works for them, that's great. But a lot of people still want to be able to have their own healthcare practice business. They want to be able to choose who the patients are. They want to be able to come and go as they please, so to speak. But they also don't want the business to own them. And that can be the real problem. If we don't take all of this into account, if we don't plan out, if we don't focus on these different areas at appropriate times and deal with it, the business will own us. We might as well work for somebody else then, because we're going to work harder, we're going to spend more time, we're going to invest more emotionally, personally, financially, probably in that business. And so as a real commitment, we need to not just open the doors, we need to do the rest of the stuff. That's where we help our clients with all those things and really running this like a business. Once again, I'm Philip Bluestein with Healthcare Practice Advisors. We are happy to talk to people who are interested in our services. We would love to talk to you. So give us a call, 720-420-1777, and let's have a conversation about what your healthcare business is like and how we can help you with it. Thank you very much and have a great day.